Every year, employers get a renewal letter with a big number on it, but what they almost never get is the report that generated that number. Today, I'm going to show you what's inside that report, the 5 data points that actually drive your costs, and what to do if your broker has never shown you one. Okay, so first and foremost, if you are on a fully insured plan, you may not have access to your own claims data. That's not an accident, that is done on purpose. It's a feature of the fully insured model. And it's the reason why it's one of the most profitable segments in the entire industry. The carrier collects your premium, the carrier pays the claims. The carrier owns the data, and you get a very opaque summary if you ask for it, and then a renewal number you are supposed to accept. This is the single most important reason why employers consider self-funding, not the cost savings in year one, because the cost savings really do compound over the years, but it's the data ownership. That is your data, and you should know what it looks like. Okay, the 5 numbers that matter. Number 1 is your loss ratio. This is the total claims paid divided by the total premium collected. So a loss ratio of 75% means for every dollar you paid in premium, 75 cents went to claims, and the rest went to administration, profit, and retention. If your loss ratio is consistently under 70%, you have leverage in a renewal negotiation, and you're probably a really good self-funding candidate. Okay, number 2, PMPM, per member per month. This normalizes your claim spend across your population size, and it lets you compare year over year. The national benchmark for employer-sponsored plans is roughly 450 to 550 PMPM per member per month, depending on the industry and demographics. So know where you are. All right, number 3, large claimant threshold and specific stop-loss attachment. So one catastrophic case can drive an entire year of trend. If you ever have one claimant who has crossed $100,000 in claims, that case might be the entire story behind your renewal increase. Also, is this person still covered? Are they in remission? Or is it resolved? Because those make really good cases to the underwriter. And remember, if you're under 70% in your loss ratio, you have leverage. Okay, number 4, diagnostic category split. Where is the spend concentrated? Is it MSK? Is it cardiovascular, oncology, mental health? The category split will tell you what interventions are worth implementing, aka point solutions that address those concerns specifically. If 30% of your spend is MSK, an MSK program is going to have real ROI for your population. If you don't know the split, you can't make that call. So data is super, super important. Organized data is even more important. And number 5, pharmacy as a percent of total spend. Pharmacy's out of control. In most employer populations, pharmacy is now 25 to 35% of total plan spend. If your PBM rebate structure is opaque, meaning you don't know what portion the PBM is keeping, you don't know if there's a spread, you don't know how much in rebates you should be getting back, then you have a significant blind spot. Pharmacy is really not a commodity line item anymore. Okay, so what to do if you can't get the data? If you're on a fully insured plan with under 100 employees, your carrier might not be legally required to give you the underlying claims report. So here's what you do. First, ask your broker in writing for a summary experience report, not a pie chart. An actual summary with per member, per month cost, ratio, and diagnostic information. Okay, second, if they tell you it's not available, ask why, always ask why. Carriers do produce these reports in some way. You know, whether your broker has access to them and is willing to pull them is a different question. But for instance, here in Texas, Blue Cross has Blue Insights report. You can usually ask for some sort of utilization report if you're fully insured. Okay, third, If you're approaching 50 or more employees, if you have at least 40 and your broker hasn't discussed self funding or level funding, I guess, you're working with someone who either doesn't know the space or has an incentive to keep you fully insured. There's no reason why that should not be on the table right now. But either answer is worth knowing. Okay, now the self funding bridge. Everything I've described today, the loss ratio per member per month, claimant analysis, the diagnostic mix, pharmacy spend, that's all information you own the moment you move into a self funded plan. You get monthly claims reports, you see every single dollar, and you actually have control. You can model interventions, and at the end of the year, if your claims came in under the expected amount, the excess stays with you, not the carrier. And then you can, reinvest into your company and into your employees and buy them even richer benefits. And this really isn't a pitch, that's the math. Whether self funding makes sense for your group depends on size and risk tolerance and, and cash flow, of course. That's a separate conversation. But data ownership alone changes how you manage your program. So, your call to action, if you have never seen your claims data in the format I described today, per member per month, the loss ratio, diagnostic category breakdown, ask your broker. Ask your broker for it this week. Put it in writing. What you get back is going to tell you a lot. Right, next week we're talking about vertical integration. Make sure you subscribe so you don't miss.